Hey, this is Eric Weiss. So last week we talked about hemorrhage control. So when it came to that, you had the foundation of understanding bleeding control, why are people bleeding, massive bleeding, the different types of trauma, different types of hemorrhage, different types of shock. But this week we're going to actually get into the skills portion of it. So your objective today is to actually apply to tourniquet. We talked about tourniquets, types of tourniquets before, but we're actually going to do the skills when it comes to this one. Now, when it came to last, we talked about the three types of tourniquets. Those three types of tourniquets that we discussed was going to be the cat tourniquet. You also had the soft T tourniquet. In addition to that, you had the SAM XT. Now, of these three, the more common ones you're actually going to face will be the cat tourniquet as well as the soft T tourniquet. So what we're going to do is focus on both the cat and the soft T. We're not going to really focus on the SAM XT tourniquet because that's not more of a common one. But when it comes to just simple injuries, or hemorrhage control, we want to make sure you're comfortable with the first two. Now, if we get the SAM XT out in the real world, it's going to be a little bit of a learning curve. But for this skill section, we're focusing on both the cat tourniquet and the soft T tourniquet. We want to know the similarities and differences between those. So looking up here, like I stated before, you have two types of tourniquets. You have your cat tourniquet and you have your soft T tourniquet. And they look similar and they do serve the same function. However, they are a little bit different like we discussed prior to. When it comes to the cat tourniquet, it does have your windlass. So we did talk about that. So it does have your windlass. It does have secure clamp. It has your tab. But in this one, you also have Velcro. So this one is your Velcro setting. And I like this one a little more. And you also face this one more in the real world. So let's say if we're doing a TECC course or you're on a gun range, something of that nature, you have one of your IFAC, you come across somebody with an IFAC, the more likely going to have the cat tourniquet. When it comes to the cat tourniquet, like I stated before, looking at the different parts of it, you actually have your loop, but when it comes to that, you have a red tab. I tell people when applying this red tab, you want to make sure that it's pointed towards you. So if it's for self-application, you want to make sure that tourniquet is pointed inwards towards you so you can actually pull better for leverage. If you're applying it to someone, you want to make sure it's away from them but towards you for leverage as well. We're going to demonstrate that. So I'm going to model this, and then after I model this, you're going to actually do it. Then after that, you're going to actually be tested on 4 skills. Up behind me, so as you can see up behind me, you do have your checklist or your skill checklist, and that's what we're going to go over to make sure you're actually doing it correctly. But we have to make sure we have a good foundation of understanding of this. So again, this is your cat tourniquet. When it comes to your cat tourniquet, like I stated before, I'm going to demonstrate on myself. We notice that when you're doing this, you go high and tight. So as you go up high and tight, again, according to the Stop the Bleed regulations, you want to go 2 inches above the wound. But if we're in a scene that is not safe, or if we're in a scene that may actually become compromised, we're just going to go up high and tight. You go up high, tight, and notice that the red tab is actually pointing in towards me. And what I do, cinch it down. As I cinch it down, I lock it in place. Then this windlass, when it comes to this windlass, I tell people, think of the windlass of that of a faucet. Think about when your faucet is running, you turn the knob to slow the water down to eventually for it to stop. That's what this windlass is for. This windlass is for it to slow the bleed down to eventually stop. So imagine if it's an arterial bleed, it is squirting out with the contraction of the heart. So with that, you're going to constantly crank this windlass down. As you crank this windlass down, you would then put it in the securing tab, and that's where that comes to play. You have your extra you have your extra webbing in there. You just put it in, and then you have your time or your securing strap. You place it over and record your time on that. Now, the purpose of this first is to stop that massive hemorrhage. Again, yes, when cranking it down, it's going to stop the massive hemorrhage, but at the same time, it's going to cause pain. I tell people, when you think about it, pain is good. In this case, you could say pain is good. The reason I say pain is good is because that person is conscious and they're alert and know what's going on. So if they're screaming, they're with us, and that's a good thing. They may be going through compensated shock, but they're with us at this point, and you want to make sure you want to try to stop that bleeding as much as possible before they bleed out. So again, you have your time, you have your actual time. That time is for us as if we're rolling up on scene. As we roll up on scene, we want to know how long that tourniquet's been on. Again, in the urban setting, because I'm like I say, we're in an urban setting, so in the urban setting for us, Metro Atlanta, we're going to be to Grady Hospital within 30 minutes. So yes, the tourniquet can be on there in 30 minutes, even greater than that. From what the records show, I think the time was the longest it's been on, and this was in a battlefield in Iraq in I think 2006, somewhere around there, that it's been on over 10 hours with no permanent damage. Now, in urban setting, in our real world, we don't want to have it on that long, but that was that case. That's not that common case for us. In an hour or so, then it's coming off. But once you place that tourniquet on, it stays on. So in this one is your cat tourniquet. And like I said before, I like this because it has the Velcro and it's easier for self-application. Now, I'm going to model this on my friend over here, Sam, in a second. Your other tourniquet is going to be your soft T tourniquet. When it comes to your soft T tourniquet, similar to that of the cat tourniquet, it does have the lubing, but this case, it doesn't have what we call the Velcro strapping. This one has the belt or the webbing, so it's a little more slippery, so it slides against your clothing, where the one where your cat tourniquet had the Velcro will stop, but your soft T tourniquet has the webbing, so it's a little more difficult for self-application. Another thing that's different from this is when you're securing that cat tourniquet, you have the belt loop. When securing the soft T tourniquet, you have a hook. So basically go around whatever limb it is. Again, remember laws of two. If it's a law of two, you can apply it there. 2 arms, 2 legs, so you can apply it there. You place it around, you secure it in. As you secure it in, you sink it down or cinch it down. Again, you have your windlass. You crank that windlass all the way up. You secure it in. Now notice here, unlike the cat tourniquet, where you have the hooks and you actually have this webbing here or this Velcro here, this one actually has a triangle. So you secure it with the triangle. So you put it in the locking clamp and then you place it down with the triangle. That's how you secure this one. Again, this is a little more difficult on self-application, but it does work. What we stated before, and we'll reflect back to last week and before when we talk about massive hemorrhage. You apply this if they're bleeding out. Not when we're packing wounds, but if they're bleeding out and if it's an arterial bleed. Again, being at this level, you should know the difference between a venous bleed and arterial bleed. Your venous bleed is more or less the oozing. Your arterial is actually pushing out because of the high pressure. So when I'm pulling over here, my mannequin Sam. So if you take a look at Sam, let's say Sam got shot. He got shot in the arm. And notice right here, make sure I tell you right. Notice right here, this is your artery. That artery is under a lot of pressure. So every time that heart contracts, it's pushing blood out. So if he got shot anywhere in this artery, which is located to the aortic arch, that's pushing out, he's going to bleed out. So with the cat tourniquet, again, when it comes to cat tourniquet, yours may be staged. If you're on a range, a TECC course, it may not be staged. If it's not staged, what we want to do is we want to try to have it staged. But we slide it in, or in this case, since I'm already here, I'm going to actually put it around him. Now, notice the red tip is towards me. I slide it through the belt loop. Here, I'm going high and tight. Red tip tab is above me. I'm cinching down, locking down. Again, hopefully to try to slow some of that bleed. In addition to that, notice I'm behind them. I am behind them, so in case he tends to pass out, I can actually catch him. The biggest thing is you don't want to try to catch dead weight, so you put your leg in between their legs, so if they're passing out, it's like a sliding board, they can slide down. So with that, I cinch down. As I cinch down, I then crank it. So I'm cranking this up as much as possible, as tight as possible, just like that when it comes to a faucet. Lock it down, cinch it down. This extra webbing, I'm just going to slide it over and across, slide it through, just like that. Then I have my time tab, place it over, write the time on there. That way we know, that way when EMS arrives, we know what time or when, about what time it's been applied. The objective is to stop massive hemorrhage. Now, when it comes to the soft T tourniquet, similar application. Again, remember what I said, we're doing this model, I do, we do, you do. I'm demonstrating, then we're gonna do it together. Then, like I said before, up there on your checklist or skills list is when you're gonna do it to be evaluated. So this one is your soft T tourniquet. Same concept, even if it's not staged. Let's say, hey, this one's what stage it was already locked in. All I'm gonna do is slide it over his arm. Again, slide it over his arm. if he's up and he's conscious, I'm like, hey, go ahead and put direct pressure there. Help me out, put some direct pressure there, try to slow that bleeding down. As he's doing that, I notice he's following direction, so he's with us. So I put it over, I'm cinching down as much as possible, so I'm locking it down. As I lock it down, I'm then cranking this windlass up, like we said before, similar to that little faucet. Lock it down, I crank it up, I then put it in the securing tab. As I put it in the securing tab, I then get the triangle and I lock it in. From there, this one has a time tab as well. On the time tab, I record the time, approximation of what time. So let's say we're Central Time now, so it's about 14:53, so I'm put 14:50, 14:53 up there so I know what time. So if EMS comes or when the EMS comes and they arrive, they know what to do. The purpose of this, like stated before, is to stop your massive hemorrhage. Now, yes, if we have time, we can use the Israeli bandage, what we discussed before, but for right now, that's not what we're referring to. Now, moving Sam out the way, coming up here for our checklist. What you're going to be evaluated on is literally up here. We're going to have student name, we're going to have today's date, as student name, today's date. Then it tells you, hey, your scenario, you come across a person with a cut, in this case, a massive laceration on their forearm. You would then demonstrate, stop the bleeding by applying a tourniquet. So what we're doing here is literally steps 1 through step 8. You're doing step 1 through step 8. Step 1, remove cat tourniquet from IFAC. Step 2, slide the wounded extremity through the loop of the self-adhering band and wrap around the extremity, which we talked about before. Step 3, position the cat tourniquet at least 2 inches above that injury or high and tight. Step 4, you're going to crank that windlass. Again, you're going to crank that windlass until distal pulse is actually stops or no longer palpable. Lock the rod in place with the clip, grasp the windlass strap, pull it tight, adhere to the Velcro. So putting the Velcro, the securing Velcro over, you're going to then verbalize using a marker, recording the time down. We as evaluator, we're going to evaluate on this. Total time for this is 60 seconds. In the real world, we want this less than 30 seconds. But in the classroom portion of this, we want it no more than 60 seconds. So again, going back over here to demonstrate. I come over to the person. Yes, PPE. So matter of fact, let me get some PPEs just to demonstrate real quick. Give me 1 second. Sorry about that. So here we go. So I have my PPEs on. So I'm coming up. So yes, scene is safe. We're in a classroom setting. Scene is safe. As the scene is safe, coming up to the person using a cat tourniquet. Hey, are you okay? I notice you have a massive bleeding there. Since you have a massive bleeding, we want to stop that. Can you apply direct pressure there for me? I'm gonna apply a tourniquet. I'm behind them. That's step 1. Notice what's going on. From there, timer has started. I have 60 seconds. Again, I'm going across, going high and tight. As I'm doing this, I'm talking to the patient. Hey, are you okay? So what happened? What exactly happened to you? How are you feeling? Things of that nature. I'm going through all of my primary and secondary assessment when it comes to this. Now from here, high and tight, I'll lock it down. As I lock it down, cinch it down, got the windlass, turning the windlass, cranking it up. As I crank it up, I'll lock it in place, have my extra webbing, put it there, time tab, put it over, record the time. Again, we're looking at no more than 60 seconds. Our objective is to make sure we get it done in 30 seconds or less, but a classroom portion, we're going to do it in 60 seconds or less. Now, are there any questions about this? There's no questions. Again, our biggest reason for doing or using a tourniquet is for massive bleeding. If it's squirting out, we have to stop that massive hemorrhage. Again, this is not wound packing. This is massive hemorrhage if it's coming out. That's our objective. If there's no questions, let's go ahead and begin.